If your partner is bald and you can't pull the hair, slap them upside the head instead. What's an NSFW pro tip everyone should know? I'm so excited to see you again, viewer. Thanks for coming to another story time. If we haven't met yet, I'm Andrew, your narrator. I don't want to miss any more story times with you. So be sure to like the video, subscribe, and ring the bell button. Or else I'll steal your anime waifu body pillow. Enough messing around, let's get into the stories. Keep a change of clothes in a bag in the trunk of your car. You really never know too far in advance when you're going to crap yourself. Don't stick anything up your ass unless it has a flared base. Or do, if you want to keep giving doctors and nurses stories about patients falling on objects. Trouble with your gag reflex while giving head? Make a fist with your left hand and squeeze your thumb. I thought it was bullcrap. It worked for me. Edit. I'm glad dick sucking has brought so many together. If you need to get rid of an erection quickly, then tense up your legs for a while and it'll get rid of it quicker. Edit. Getting lots of people suggesting the same stuff, so here's a couple of those. Hold your breath, take a walk, think about naked grandma. Never get a lap dance while going commando. The inside of your zipper will eat you alive. Edit. I guess I should explain that I learned this at a house party, not a strip club, and I wasn't expecting to be getting a lap dance when choosing my clothes for the day. As for going commando, I was going through a weird phase where I thought it was more comfortable, but after a few unfortunate dick and zipper interactions, I decided to start wearing boxers again. Reverse cowgirl, on paper, is an incredibly sexy position. But it's also the single most dangerous sex position and responsible for hundreds of ER visits a year. Be very careful with any position wherein your partner drops down on your penis, as it can bend or even break your penis, and your partner can be penetrated too deeply, causing internal punctures. Slow and steady is the name of the game. Girls? Always pee right after sex. Always. Edit. Also, apparently men should pee after sex too. However, because their urethra path to the bladder and whatnot is longer in men, UTIs are much less common in men. Usually a man will get a UTI because of other contributing factors, not just sex, not drinking enough water. On the other hand, girls can easily get a UTI from just sex. Hence my comment. EDIT too. And let's be honest. A lot of stuff just shot out of your, guys, area. Peeing to clean it out doesn't seem like such a bad idea, so sticky. Shivers. If you're a male and have recently masturbated, be sure to pull the sides of your penis tip apart before taking a piss, like you are trying to make your dick hole talk. It will make sure any dried semen hasn't partially sealed your urethra, which would make your piss come out in multi-directional streams. Also, as you finish masturbating and your penis starts to go soft, reach a bit back to the rear of your ballsack and squeeze your penis, the part that you can't see, but feel behind your ballsack as your penis attaches to your body a bit, and keep squeezing as you move towards the tip. You'll likely get a little more semen to come out. This won't prevent the previous issue, but if you have a busy day ahead of you, the removal of that last bit will prevent that uncomfortable wet spot on your boxers or briefs. Performing cunnilingus and a stray pube gets stuck to your tongue? Lick the inner thigh to get the hair unstuck from your tongue. To be honest, any patch of skin that isn't slick with bodily fluids is fine. It's just easy to do the inner thigh cause it's close. Saw this on a thread like this months ago. Have tried it multiple times during oral and it has worked every time. Also, whenever I randomly get hair on my tongue, I just quickly dab my tongue on the back of my hand and it works too. Kegel exercises have many benefits, including treating bladder and bowel problems, vaginismus, erectile dysfunctions, easier childbirth, and increased chances of multiple orgasms in women and men. If you do them and your bladder or bowel symptoms get worse and/or you have painful arousal or painful sex, see a DR about being evaluated for pelvic floor dysfunction. Uro or gyno is best. There are two types. One is where the pelvic floor muscles are chronically too tight. In that case, Kegels will only make it worse. Most people have only heard of Kegels helping the pelvic floor because 1. It does help if the area is normal healthy, and 2. Because of the kind where the muscles are too loose is common with childbirth and therefore more heard of. Physical therapy can help. Sincerely, someone with pelvic floor dysfunction who has been through all that and seen a lot of other people suffer with it as well without knowing. If she reacts in a positive way and says something along the lines of "don't stop. Do exactly what you are doing with no variation whatsoever." Edit. Did not expect this to get this much attention. Thank you for the gold and silver. To shed some light on why men duck this up. It's like breathing. When you aren't thinking about it, it just happens and the process goes smoothly. But now I mentioned breathing, and you are doing it manually now, and it's confusing and hard, and what were you doing before? Same thing. You say don't stop and suddenly we are conscious of 1,000 different things, and we have no idea what we were doing because we were lost in the moment. Also, we are idiots. Don't surprise someone by sticking a finger in their bum in the middle. I don't know why so many guys I've been with think this is fun or a turn on. It certainly doesn't feel nice when it's a dry as duck finger going in an equally dry as duck asshole. Use lube for anal. And when you think you have enough lube for anal, use some more. Edit. Since this gained traction, I also want to add a couple things. Consent is an important thing. If you don't have consent to stick it in the bum, don't. Ask first. If they say no, then oh well. If they say yes, then you can try. Also, like some commenters said, trim your damn nails and keep them clean before you stick your fingers in a bum. This has been sex ed from someone who learned the hard way about butts. P.S. Don't put icy hot in your butt or use icy hot lube. Also, don't use dotted or ribbed condoms without asking if they like it. They hurt. P.P.S. All of this goes with genders reversed. Women, don't stick your finger in your man's woman's bum without asking. Men, don't stick your finger in your man's bum without asking. I can only really offer advice for a guy looking to sex ladies. Don't call it sexing them. That's lesson 0.5. Some general advice. 1. No piece of advice applies to all women. These are just guidelines that should be applicable to most folks, but communication is key, as I'll explain later. 2. Hygiene goes without saying. Keep it clean. 3. Keep your nails short. If you forgot this until the last moment, clip them and run the edges on your jeans to dull them a little. No one wants to get fingered by Scary Terry, bitch. 4. Orgasms are not always required. Obviously they're great, but if either you or your partner doesn't finish after you've given it the good old college try, don't get down on yourself about it. Sex should be fun even before the orgasm. Put her pleasure above yours, and she'll probably take care of you. 5. Use protection. Yes, it feels better without it, but let me tell you what doesn't feel good. Child support payments. Chlamydia. Full-blown AIDS. Or at least I assume they don't, because I've never experienced any of those things. Because I use protection. When used correctly, condoms are 98% effective at preventing pregnancy, according to the knockout blurb Google gave me when I searched condom effectiveness. Look up a YouTube video if you're not sure if you're using them 100% correctly. And I don't care how strong you think your pull-out game is, entrusting a horny dude with the task of not ejaculating inside a woman that's saying, "Duck me harder, baby," like your partners will be saying once you're done reading this guide, is dumber than sending a kid to the Jared Fogle summer camp. That was a real thing, look it up. And get tested after each new partner, just in case. Can't be too careful. 6. Don't masturbate with too tight a grip. You'll kill the sensitivity in your dick. Use a loose but firm grip and lubricate yourself. If you're a frequent dick crusher, switch to the aforementioned technique, no exceptions. If you find that doesn't get you off, well, too bad. You don't get to finish until you can finish like that, because otherwise you'll be in the unenviable position of not being able to finish while ducking. And then she'll get self-conscious, you'll be embarrassed, it'll be awful. Beware the death grip. 7. Pee after you finish. It's even more important for women, but it goes a long way toward preventing urinary tract infections. 8. Make some noise. Probably. Most women tend to like it when you're vocal. Don't go overboard. Grunting like a warthog, like a lot of porn stars seem to do, is probably too much. But let her know you're enjoying yourself. Tell her how good her hand, mouth, pussy, ass feels, how much you love her tits, ass, legs, pussy, etc. Unless she's not into dirty talk, which is fine too. 9. Don't be embarrassed. Not getting it up happens. Shooting your load too soon happens. Farts, queefs, armpit fart noises because your skin was suctioned to hers, it happens. Get used to it. Laugh about it. Enjoy yourself.
Like and subscribe for more funny, interesting, and scary r/ask Reddit videos.